Hi, this is the very first Heart Valve Disease Awareness Day. It's February 22nd, and it happens to be Wednesday, and I had my surgery on Wednesday, January 4th, so this is week 7 for me, and I'm going to be very brave. I'm going to show you my scar, and I also have, the last time I worked out was on January 4th at like 3 a.m. prior to surgery. So I've not trained since then because you have a ton of obviously recovery and movement restrictions, so your sternum doesn't open up. But I'm at the point now where I can actually begin to do some things. I'm going to show you what I'm going to do to get out of this. So here I am. I'm going to be brave. Here's my selfie scar from my surgery. So it's from here and it goes all the way down to there. And the reason it's a little longer is because I also had an aortic septic defect down here and an aneurysm around the root of my my aortic root because of the pressure trying to go through such a compromised valve for so long. So here I am, post-surgery, 7 weeks, and I still feel like I've been beaten up. So I'm just very thankful. My husband happens to be an expert on this restorative historical movement arts that involve tools that are not usually represented in today's fitness world. And because of their circular and opening patterns, they're very gentle. So it's perfect for what I'm trying to accomplish right now, which is to regain function. So I'm just going to show you a sample of some of the things I'm beginning to do. Okay, so the first thing I'm going to show you is called a double ball staff. And last night Ron showed me some things to do. I'm going to take off my Uggs. Okay, so you hold it like this, and hopefully I can remember how to do it correctly, but just the simple beginning to move this onto keeping it in my center here, and then rotating gently is very challenging for me. Okay, and so I'm going very slow, not holding my breath. I'm not feeling any pain. It's just challenging to begin to open this area up very gently. Okay, so I just move it from here, and then I also keep my thumb open and try to rotate back as I open. Okay, so that was one of the things that I thought was extremely beneficial, because I basically haven't been hugging my Bruin bear, which is something they give you at UCLA to help you brace yourself. Okay, so I've been in this position. Okay, so that's one of the things I've been doing. And then the other thing that I've been doing, I'm using these half-pound ending clubs, and literally I just started doing this. These are considered one of the tools of the 4 horsemen in restorative fitness arts. And let me just show you the very simple things that I've been doing. So this is a classical PE, physical education tool, and so you have to have like this slightly turned out stance, and you put your hand right here. Okay, and then I'm going to show you the most difficult side for me. This side obviously is my left side where your heart is. It's been extremely uncomfortable, as any of the heart valve replacement people would know. Okay, so basically what I'm going to do is I'm going to hold it like this in the front, and then I'm going to try to make a big circle with my elbow and open up as much as possible. Okay, and that has been very beneficial. Okay, if you don't have one of these, you can just do it without anything, which I also worked on too. And then you can extend it, and I'm not being too hard on myself, because for me just extending my arms is challenging. Okay, so I'm coming down with control, trying to breathe normally. I'm trying to make a big circle with my shoulder. The reason I like this half pound is just enough to kind of open my shoulder up with just enough weight back there, and then I extend and I try to look at it and see if I am in at the side. Okay, and then I just come down. Very gentle movements, very restorative. Okay, I need to scoot over to do the other side because my daughter's martial arts bag. Okay, so here I am. Come down. Try not to strain anything. This side is a bit easier. There wasn't as much trauma, I think, on this side. So I'm going to do 3, which I can do a lot quicker. But then I'm going to come back and do double on this side because this side tends to have a little more issues. And you can see as I'm warming up here, it's just getting easier. These are very non-threatening movements to your body. Okay, I know the fitness industry likes to entertain you with lots of burpees and crazy stuff balancing on balls, but this is where people need to be. To restore function so you can breathe better. You know, gravity is a gym. Okay, so I don't want to age in this kyphotic candy cane position, which is a risk for me because I was basically cut up here and pried open, okay? And I don't want to age like that. I'm so thankful that I'm aware with my movement background and the knowledge from, you know, people that have taught me and my husband as well, that I need to reset my posture so my diaphragm works well, my pelvic floor is working well, and this is the gravity, this is the gym that gravity is providing me. So our brain will reinforce this and all my movements will start to look like this, and that will just develop more injury down the road. So learning that you need to take time to restore your body with something as gentle is good, not just for people with scars that have been spliced open, but for pretty much everybody because of our tech use and our sitting lifestyles. Okay, so you know, just ignore all those fitspirations. So here I am, I'm in my Target pants that are 5 years old, right? I'm in my for sale, cheap, you know, fitness clothes. I'm not glamorous. I've been broken and I've been hacked, but my life has been saved. So I'm telling you, it's a different kind of brave to be able to do all kinds of this type of stuff. Okay, so I'm being brave today. I'm being smart, and more later. Thanks for watching. Bye.